One of the oldest and most misunderstood treatments in all of mental health still happens to be one of the most effective. And yes, that treatment is ECT, or electroconvulsive therapy. And I definitely understand that for many people, that still conjures up this outdated, cruel, and even barbaric treatment. Because with many things I talk about here, the truth is much more nuanced and interesting than that. Because ECT, believe it or not, is still widely used in many medical centers and psychiatric hospitals around the world. And for many severe mental health conditions, it's still the most effective and fastest acting treatment. So today, I want to talk about ECT. I want to cover its history, what it actually looks like in a modern clinical setting, what sort of situations it can be used for, and some of the actual side effects that it can come with. And of course, dispel many myths around it. And at the end, I'll go over some of my own clinical examples of how ECT has turned patients' lives around. And for those of you who are new to the channel, welcome. I'm Dr. Robert. I'm a board-certified psychiatrist. And on this channel, I enjoy making mental health videos. And of course, as always, these are for educational purposes only, not medical advice. And if you are experiencing any mental health symptoms, definitely seek out the care of a licensed professional near you. So to understand why ECT has the stigma it has, you have to go back to the time frame of when it first originated, which was back in the 1930s. And as you may be aware, in the 1930s, psychiatry did not have very many great treatment options. There weren't any SSRIs, mood stabilizers, antipsychotics. Even the therapy options back then weren't very robust. So people with severe mental health issues had very few options. And many of those options were not great. Think insulin treatments, getting injected with insulin to induce a hypoglycemic state, and also some barbaric treatments of isolation, restraints, and yes, of course, the notorious frontal lobotomy. And in this world where there were few treatment options, there was a lot of mental health stigma, and many patients were abused, came this treatment of ECT. And in the late 1930s, two Italian scientists came up with the first ECT treatment. I'm gonna read it off because I hope I pronounce it correctly. Ugo Cerletti and Lucio Bini. But basically, these two Italian physicians, they came up with a way of inducing a seizure in their patients because it was kind of known at the time that after a seizure, people's depressive symptoms, and other mental health symptoms would lessen. And in a world where very few options seem to actually have a positive effect, this was huge. It actually didn't take too long for ECT to become adopted around the world as an effective treatment for mental health conditions. Back then, ECT was a lot different than it is today. And one could maybe describe it as barbaric back then because anesthesia wasn't readily available. So people were not anesthetized for this. So they were awake during the procedure. There weren't any muscle relaxants, and that could even lead to bones breaking because of the seizures. And people clenching on their lips, their tongues. And the voltage, the dosing of the ECT was not carefully calibrated or fully understood. So back then it was a very unpleasant, very unsavory procedure. And then the public image of ECT was further shaped by movies and books like One Flew Over the Cuckoo's Nest, where ECT was used as a form of coercion and punishment. It was depicted in a very dehumanizing way. And that image has definitely stuck around to this day. But despite all of this, the treatment didn't fizzle out, it didn't go away. And that's because it was effective. It did treat people's depression, psychosis, catatonia. But of course, over the decades, it has greatly evolved, and today's ECT looks nothing like it did 100 years ago. So let's talk about what modern ECT actually looks like. Today, if you're going to go get an ECT treatment, which thousands of people do every year, you show up to a hospital, you get checked in, and like with any other procedure, you go to a pre-op area, get into a gown, get hooked up to a heart monitor, and then you get wheeled back into the ECT suite. Typically, that looks like any other operating room, which I get can still be a little bit scary for many people, right? Because procedures in the first place are not comfortable, exciting things. They bring on a degree of anxiety and uncertainty. So I think that component is still there. But unlike ECT 100 years ago, you are put under anesthesia, always, every time. People are not awake during the procedure. And you're monitored under the anesthesia by a trained, qualified professional to make sure the procedure is very safe. And you also get administered a dose of a muscle relaxant. So your muscles don't like fully spaz out during the actual seizure. And the seizures themselves are administered through these little pads placed onto the scalp, and the psychiatrist administering it calibrates a proper voltage, and the voltage administered for the seizure. All of that sort of depends on the clinical picture, the patient's history, and if you guys are interested, I can get into that in future videos. So all in all, it's a very quick, standardized, well-monitored, and safe procedure. Now I'll get into some of the risks and other considerations in a little bit, but next I want to talk about who is this for in the first place. So ECT as a treatment is typically reserved for patients who have very severe symptoms of something like depression or catatonia or mania, or other treatment options are just not working for them for whatever reasons. Or third, because waiting for other options that may take longer might be dangerous, and ECT, because it's so fast acting, is the more appropriate treatment option. So the most common type of case for ECT would be severe depression. And this wouldn't be someone experiencing moderate depression where they have periods of sadness, feeling down for a bit. I'm talking some severe depression. So here it's difficulty getting out of bed, difficulty motivating, really intense, debilitating thoughts about not wanting to live. Definitely people who stop eating, can't sleep, or sleep all day. Some very severe cases. And other treatment options like SSRIs, talk therapy, behavioral changes, they're not doing anything. Or the symptoms are so severe that waiting for other options to kick in to start working would be too dangerous. Perhaps one of the most effective uses of ECT is actually for catatonia. And I won't go fully into what that is in this video. I'll make a future video on catatonia. But basically it's a mental health condition, sometimes a neurologic condition, where someone can go mute or get stuck in a very specific position, or sometimes show these bizarre repetitive behaviors. And if untreated, catatonia can actually lead to death. So ECT can be a very helpful treatment option that works quickly to resolve it. Another common use of ECT is for severe mania. So if someone has bipolar disorder and they're in a very severe manic episode that's not being treated adequately with antipsychotics, mood stabilizers, then ECT can be a great way to sort of break the manic episode. And a fairly surprising for many people use of ECT is in patients who are actually pregnant. Yes, it's commonly used in pregnancy, because we know from a lot of research and just clinical experience too that severe depression in pregnancy can be life-threatening to the mom and potentially the baby as well in severe cases. And so ECT can be a very quick-acting and surprisingly safe treatment option. I think when most people think about ECT in pregnancy, it kind of scares them. They think, this procedure, doesn't that sound like it'd be unsafe? But in reality, it's actually one of the safest options for pregnant women with severe depression or mania or catatonia. It actually protects the fetus from being exposed to high levels of psychiatric medications. Often in pregnancy, these symptoms can be so severe that you need something that works quickly, not in a few weeks. So this can definitely offer that. I think for many people, they can view ECT as this is too drastic, too dramatic of an option. But in situations where it is used, it is a drastic situation. And if people aren't eating, if they're constantly feeling like they want to end their lives, if they're pregnant and suffering from very severe mental health symptoms, these are dramatic situations, and they call for these sort of treatment options because the alternative, well, that could be very life-threatening. But of course, ECT is not risk-free. So let's talk about some of the potential risks of ECT. Of course, this is where I need to stay balanced, right? Because ECT definitely is not for everyone. It's not 100% safe, and it definitely comes with its own risks. So let's talk about the main risk of ECT. And that's actually not from the ECT itself, but it's from the anesthesia associated with it. Because, right, as I mentioned, for ECT, you have to go under anesthesia, even if briefly, but that comes with its own risks. So that would be the main risk of ECT, is actually the anesthesia used for it, not the procedure itself. That's also why you have a trained anesthesiology team monitoring you and making sure everything's okay. The next risk I want to talk about, and the one that probably concerns most people, is its impact on memory. Because ECT is notorious for affecting people's memory, mainly short-term memory, but in some rare instances, even long-term memory. Because it's not uncommon for people undergoing ECT to have some memory lapses, some memory gaps around the time of the procedure. For most people undergoing this procedure, the memory issues that do come up are very minor and temporary. But for some people, they can be a little bit more pronounced and take a while to resolve. But it's definitely one that needs to be taken seriously. And appropriate ECT procedure has patients undergoing a cognitive exam every certain amount of treatments just to monitor the degree of their potential memory issues. And of course, there are ways of mitigating those memory issues using like a unilateral approach rather than a bilateral approach where it just hits one lobe rather than both. You can also change some settings on the ECT machine to sort of reduce the risk of that. So definitely worthwhile talking to your doctor about that. Some other common but temporary side effects are things like headaches, some fatigue, just kind of feeling out of it day of after the procedure. Also some nausea and muscle soreness can happen. Some fairly easily manageable things are very short term, and people will definitely take that as a trade-off for further severe mental health symptoms. And then there are also some practical considerations, because ECT is not a thing you just do once and you're good to go. You have to go back, and it can take weeks of treatment to actually get full results and to have those results sustained. So people may have to often go 3 times a week for multiple weeks and then scale back their frequency over time. So that's a lot of dedication, right? You have to show up to a hospital very early in the morning 3 times a week. So that can really interfere with your schedule and just be kind of a pain. And then of course, insurance approval, because it can be an expensive procedure. But I would say one of the biggest and overlooked risks of this procedure is just the stigma around it and people's experience of it. I do find that there's a lot of initial inherent shame whenever somebody signs up for it. I think they sort of struggle with the thoughts of, if I need ECT, that means I'm really bad off. Or they struggle with this internal narrative of, this is something I should hide from people. I should feel ashamed I'm getting this procedure. And I think that can really contribute and is useful to talk about whenever a patient's undergoing something like this. I think that's kind of heartbreaking too, that that degree of stigma is there for such a useful, safe treatment. So that's why I also think it's so important to talk about, to educate more people on this procedure. And to do that best, I think it's worthwhile talking about some of my own clinical experiences of using this procedure, administering it, and the dramatic effects I've seen it have on people. So the first case I'll talk about is about this patient. I'll name him John. And this is back from when I was in medical school. And of course, all details of these patient stories have been changed to protect patient identity, naturally. But for John, seeing him when I was still, I think maybe a second-year med student, still flirting around with the idea of even becoming a psychiatrist, or shadowing this ECT specialist. Every Monday, Wednesday, Friday, he would administer ECT to about half a dozen patients. Admitted to the hospital was John. He was there, he actually had Huntington's disease, so a very severe neurologic condition, but the actual physical symptoms, the movements, that wasn't manifesting yet. But what he did have were the early symptoms of severe depression, one from the condition itself, and two, probably also just from the mental burden of knowing he had Huntington's and that seeing how his father passed away would be his future as well. I think that added to his depression. When I first met John, he could barely get out of bed. He just seemed like a shell of a human. And yet he was just in his early 30s. But he couldn't even look at me, would barely touch his food, would barely utter words, or just kind of lay there for most of the day. Almost catatonic. Looking back at it now with some more experience, I actually think he might have been catatonic. That's also probably why we saw such a dramatic shift in him. Just after the first treatment, he started sitting up to eat his lunch, which was for him a huge deal. That was a huge improvement. And after the first week of treatment, so after 3 ECT sessions, he was up and about, walking around. He was able to engage in the conversation with me, tell me about his childhood when I sat down to chat with him. It was a very, very pronounced, dramatic response to the treatment. And I'll never forget that. After that shadowing experience, I think that really reinforced my decision to go into psychiatry, because seeing someone come alive like that after looking so sick, and then this one treatment that's still so mysterious, so stigmatized, be so effective, that really captured my attention. Another one that really caught my attention was the patient I'll call Kenny, from my residency training. And I think I was an intern at the time, also working at that point on an inpatient psychiatric unit where we had ECT in the hospital adjacent to it. And there was a patient who was a musician, very accomplished guy, really nice guy, but unfortunately he had bipolar disorder. And sometimes when he got into a very severe state of mania, he became very aggressive, very violent. He also happened to be a very big guy, so he made the nursing staff very nervous. I remember some really tragic instances of where he had to be fully restrained for a period of time just because he got so unsafe and violent. What was interesting about this case as well is because his family understood bipolar disorder, Kenny understood it. They were able to get this healthcare proxy documentation that if he ever got into a state of mania, they could choose to force ECT on him even if he didn't want it, because he signed this ahead of time, was aware of this, because he understood that if he got into that sort of state, he would not be able to make decisions for himself, and he would need this treatment, which is the only thing that worked in the past when he got like this, to bring him back to his usual self. So that was kind of a unique situation here. And sure enough, we administered ECT, and after just 2 treatments, he was back to, conversing with the staff, spending time with his family, and he was able to be discharged after just a week and a half. That was another dramatic example of how ECT could bring someone back from a severe mental health crisis. The third one I'll talk about is also from my residency training, and this is when I was a 4th year, so near graduating, and I was doing my ECT elective. So I was doing ECT 3 times a week with patients. Some of them I would see in clinic, but most of them I only saw in the hospital just for the ECT portion. And there was a woman that I'll call Amy, and I'll describe her as a professional in her 50s. She was a professor, very well regarded in her field, and she'd struggled with periods of depression in her life. But most recently, she was suffering a very severe depressive episode. Basically, she'd stopped creating lesson plans, stopped going to class, stopped teaching, stopped writing, and sort of started to self-isolate and grew more and more withdrawn. She'd seen psychiatrists over the years, tried different medications, therapy, lifestyle changes, and mediocre results at best. And then after a lot of hesitation, a lot of psychoeducation by the psychiatrist she was working with, she finally agreed to give ECT a try. At that point, she felt like she had no other options. It was either this or just cease existing. And so she went through with it, and that was also a dramatic change. I think after the first few treatments, she was not very happy with it. She kind of wanted to quit. She was nauseous, had some muscle soreness. was worried about her memory issues, especially being a professor. But then again, another dramatic change. After a week of treatment, she was able to smile. For the first time, I saw these smiling creases on her face, and that was incredible to see. 2 weeks into it, she was able to start talking to me about what she taught, about some of her interests. At the end of the month, she was telling me how she was planning to get back into teaching, working on lesson plans, working on some papers she'd left dormant for a long period of time. And that was another sort of dramatic example of how this can be life-changing. So what are some of the big takeaways I want to get across in this video? One is just sort of demystify ECT, what it looks like, get rid of some of the stigma around it, and just sort of describe it as this medical procedure that's used for severe cases of some mental health conditions. But of course, it's not a miracle cure. It doesn't work for everyone. Sometimes the benefits are there, but then they wane after the course of months or years, and people need to come back in for treatment. And there are some potential risks and side effects with it as well. But at the same time, it's capable of these dramatic, rapid improvements to people's mental health. And so it should be considered as a reliable treatment, at least a treatment option for some people in some situations. As with anything else around mental health that's shrouded in stigma, I definitely want to work to dispel some of that stigma and to reduce some of the shame around people considering this or going through it. So I'm curious, did this answer your questions on ECT? Did it teach you something about it? Or what sort of other questions may you have? Please leave comments down below. I'd love to answer them, address them in future videos. And as always, thank you so much for sticking around to the end. I really appreciate your attention, your engagement. And this is still a new YouTube channel, so any likes, any subscriptions definitely goes a long way. I really appreciate you, and I look forward to seeing you in another video next week. Thanks.